Ya wanga shaye-shaye zama cikin jangon haka kamar kungiya muna kallon wasu suna yi to mu ma sai mun kaga abin ya ba mu sha'awa mun kaga abin ya ba mu sha'awa kawai mu ma sai mun ka dora yi kuma yanzu sai mun kauce wuri yanzu kuma muna da tattali muna roƙa Allah mu ma mu ga mun hita wa ganya Allah ya raba mu da kaddara mu ma mai aure mun zama uwayen wasu kudan gobe.
There are a lot of regrets, yes, because of having like backwards with my life. Like my friends have been moving forward in their own life, like success. So like I've been back. So I need achievement in my life.
Drug abuse and trafficking in narcotics and psychotropic substance is a global issue which affects the whole world, and it needs serious and urgent attention from government, NGOs, and all well-meaning members of our society.
Nigeria, a nation brimming with promises and potential, finds itself grappling with a shadow that threatens the very fabric of its future. The escalating crisis of drug abuse, from the urban center to the rural communities. No corner of society is untouched by its devastating effects. But how did we get here, and what can be done? Drug abuse in Nigeria has become a public health emergency. The National Drugs Law Enforcement Agency reports alarming statistics. Drug usage among young Nigerians aged 15 to 35 exceeds global averages. The National Bureau of Statistics highlights that 14.4% of Nigerians aged 15 to 64, approximately 14.3 million people, reported using psychoactive substances in the past year. This rate is significantly higher than the global average of 5.6%. Cannabis remained the most commonly used drug, followed by opioids, including tramadol and codeine.
Because those who are taking the drug, we will try by all means to arrest such people, keep them. Those who are selling the drug to innocent people, we arrest them, we take them to court. Then from there, court will now sentence them to correctional center.
The abuse of illicit substances should be related to poverty. There is an increased poverty in the land, and most people are looking for a way out, a softening ground for them to cushion this poverty, without knowing that that soft landing that illicit substances will provide for them is a false alarm. It only gives them a false impression that they will have a relief, but it is not true. The moment these illicit substances wear out in the system, the problem will come back to your normal sense, and it will still be there. It is equally attributed to moral decadence in the society, occasioned by irresponsible parent's activities. Parents today have failed in their responsibility in ensuring that their children are properly brought up, without knowing that God gave us these children for us to ensure that they are properly brought up, they are properly fed, and they are properly educated. But most parents today have failed in that responsibility. You see a parent having a child, the child will go out and return to the house anytime. The parents will not care to know where the child goes, what he has done, what kind of a friend is he moving up. We don't do that. We just look at it without saying anything. And it is equally a very sad situation that today most children not only feed themselves, clothe themselves, but they equally are expected to contribute to the well-being of the family. The female folks today are deeply into drug because of the fact that they go out and do all sorts of activities for them to bring food to the table in the family. So these are all things that has resulted to the increase in the use of illicit substances in our society.
What are the mental health consequences of drug and substance abuse?
Brain reward system is a network of certain structures of the brain cells. In the brain, there are certain structures that are responsible for this brain reward in association with the release of one neurotransmitter called dopamine. So this neurotransmitter, it influences the behavior and the pleasure of an individual. So there is what we call positive reinforcement. For example, any behavior could be shaped either by reward or negative consequences. Following each behavior, if it is followed by negative consequences, such behavior could be extinguished. For instance, a child who happens to touch a fire, immediately touching that fire, he will feel burned. He will draw his hand. Certainly, he will never take his hand there because the consequences that follow is negative. I could remember somebody was telling me when they were young, they commenced they tried to smoke cigarettes. He has never smoked cigarettes before then. The first smoke he had, the first puff he had, it choked him seriously, and he was coughing seriously. Since then, he never wished to take it again. So these are some of the negative consequences that make him not to continue with such a behavior. But in other way, if consequences are rewarding, they are positive, they will serve as positive reinforcement. So somebody taking psychoactive substances, that is drugs and other substances, this psychoactive substance, it activates the release of this dopamine, which is a neurotransmitter in the brain. And this dopamine, as I said earlier, it influences the behavior and the pleasure of an individual. So activation of the release of this dopamine will alter the brain chemistry, and it will alter the normal level of this dopamine in our brain, thereby causing an individual to misbehave, to be observing certain abnormal behavior, and he will feel some degree of tranquility, some degree of extraordinary pleasurable situation. This extraordinary pleasurable situation will make him to feel high, and because of this positive reinforcement he had gotten following using psychoactive substance, he will always be happy and ready to take more and more. Because usually, before one becomes an addict, it has to follow a series of phases or stages.
Professor Usman Abdul Qadir of Sociology Department, Usman Danfodio University, Sokoto, said socioeconomic factors has contributed to drug abuse in Nigeria.
When we talk about socioeconomic factors, there are three major pillars: income, occupation, education. And the level of somebody's education, income, occupation, and education is determine the kind of drug individual abuse. So there is a lot of there is correlation between socioeconomy of the individual and the kind of drug use or drug abuse. So they are correlated. So these three indices or three yardstick or measurable indices are what we call socioeconomic factors.
Aminu Sani Mabera, the Galadiman Gari of Mabera, reiterated that social issues have significantly contributed to the surge in drug abuse across the country.
It has a lot of impact in the society, especially in Nigeria. I think one of the issue of problem of drug abuse in Nigeria is social issues. Most of the people who are embedded into drug abuse, you will see them committing various of crimes, and that crimes really bring a downfall to for society or a country. And another issues that drug abuse mostly cause is economic hardship. You see, those people who are engaged in drug abuse, mostly they take what they're supposed to feed their families or what they're supposed to even survive on their own daily activities, use it to take drugs, and which the end of it is by them to to waste their money, to waste their resources in society.
What are the physical and mental health consequences of drug abuse?
Well, there are a lot of negative impacts of drug abuse on individual basis, family, community, and nation at large. In fact, even the world at large. For the individual, drug abuse has negative impact on the individual health, well-being, emotion, social status, and even economic well-being. For the health, anybody engaged in drug abuse will likely have some detrimental changes in his or her brain structure and function, which definitely affect his or her emotional and psychological health. Over time, you see that they have what we call drug dependent schizophrenia. If you go to Korea, you will see a lot of young people being admitted for neurological or psychological distress as a result of drug abuse. Then apart from that, there are even other medical conditions like cancer. For those who abuse all this smoking, alcohol, cannabis, cigarette, over time, they are likely to have lung cancer, in addition to respiratory problems. Then they are even more at risk, especially those using injection drugs like this opiate. They are more at risk of having getting this infectious diseases like HIV, hepatitis, mention them. So in addition to a lot of other diseases and emotional well-being, even sexual problems, sometimes fertility issues, even when somebody is on drugs, if he or she is abusing drugs, the drugs that are supposed to work for certain medical condition may not work properly because of the issue of drugs being used.
For individuals who have struggled with drug addictions and determined to rebuild their lives, they must go through a series of transformative processes.
Well, for addict victims, actually they need hospitalization. To achieve effective treatment approach, they need hospitalization. Such victims need to be hospitalized in psychiatric facility, because in psychiatric facility is a teamwork which comprise several professionals specialized in their own fields, who collectively work for a common cause. The psychiatrist, who is a specialized expert in the psychiatric field, the psychiatric nurses, the clinical psychologist, the psychiatric social welfare officer, the occupational therapist, all these are psychiatric team members who are responsible for taking care of the addict. For the advantage of this admission or hospitalization is that, number one, a patient will be abstained from using this substance because he will be secluded in an area where he cannot get access to the substance of abuse. Therefore, by the time he is secluded in this situation, at least we are achieving some, it helps to achieve the goal. That is one. And such patients usually they develop what we call withdrawal effect. Some patients, after stoppage of this substance for some while, they will experience some difficult situation, which at times they cannot withstand unless when they take such substance. The moment they take the substance, that is all. So it adds with this to manage with withdrawal and medication too, because some develop some psychological problem or mental health, mental manifestation, psychiatric manifestation that require treatment, that require medication. So it is only one patient is on admission. That is how this medication will be ensured.
At the community level, initiatives driven by concerned citizens and local organizations are fostering change. This effort, though small, are impactful in preventing substance abuse and supporting recovery.
We have, for example, in Sokoto, we have been working with all institutions that are concerned with control of abuse and misuse of drugs. For example, Ministry of Health, NDLEA, and networking with organizations that are controlling the situation, including NABDACO and what have you. So we have plans. For example, NGO Jama'a Community Development Initiative, we developed a project. We call it Sokoto State Community Development Project. And we send all the copies to ministries, local governments. In the booklet there, we have strategies and means through which we sensitize the community and show them the danger of taking drugs that are not prescribed from the health facilities or from the health professional.
Now, the Center for Sensitization Against Drug Abuse, as an NGO, use possible ways in order to reach out to people so that they can understand the consequences of drug abuse. Now, one of these strategies includes sensitization lectures in schools, public places, so that we'll extend the message to the people on the consequences posed by drug abuse. Another way is through counseling. Those who have started, we counsel them to let them know the consequences and sad end of drug abuse.
Barrister Ali Sidi said strengthening the judicial system will go a long way in addressing drug crisis in Nigeria.
First and foremost, we have laws that criminalize the usage of the drugs. That is number one. It is not legal, it is criminal, and it is there in our penal laws. But considering the procedure or the steps that be taken before a person is said to be convicted for an offense, you know, it is from one stage to another. From NDLEA arresting, from NDLEA investigating, from NDLEA prosecuting, before finally the court give its verdict. And this court are regular courts. All cases are coming to that court. So my advice is that I think if a special court is established for the purpose of handling drug-related cases, banditry cases, all these kind of, you know, we will have speedy dispensation of justice. And absence of that punishment or speedy dispensation of justice, that would make other people to copy what the other people have done. Because the purpose of punishment is to deter another person from copying what the other person has done, or to reform him when it reaches to the stage of reforming. That's why people are sentenced to go to the jail term in order to come back into their senses and reflect and find out that they are punished because of so conduct, so they will be able to transfer through that.
The NDLEA commandant emphasized that the fight to curb the drug crisis is overwhelmed by numerous challenges, including insufficient support from the community.
You find out that in a community, you will find 2 or 3 individuals selling these illicit substances. But this community will not form a group to come to this office and provide us with information. And in some instances, we can even go to that community to pick that these terrible people that are selling these illicit substances to their children. You find out that this community will raise up against our officers. We have instances where our officers are brutally murdered. It is a fact that everybody heard it. The community, it only takes the criminal to shout that I belong to this community, and you are seeing these people coming to carry me. and you are not doing anything. The community rose against our officers. They macheted one of my officers. So that it is as bad as it is. Instead of them to even come out and support us, that we are removing the bad egg among them, but they came out and even supported the person and killed one of my officers. And it is very difficult to see a community coming into this office to ask us to go out and provide sensitization lecture to the community. They don't do that. I'm saying this thing with fact, because you hardly see communities coming out requesting us to, which is our responsibility, to go and enlighten their children, enlighten their wives, enlighten them concerning how bad it is to start taking these drugs. You understand? So these are the problem we're having. We're having the challenges of let me just put it, irresponsibility of the community.
Expert explored various ways in which collaboration could play a vital role in tackling drug abuse and trafficking in Nigeria.
The federal government, the state government, the local government, and all stakeholders should collaborate and address this to control this drugs misuse and abuse crisis in Nigeria.
Each of these stakeholders have a responsibility or have a role to play in combating the problem of drug abuse. The first, as I made mention of, there is need for sincerity in the approach of fighting drug abuse. As I said initially, a lot of programs have been called for, campaign and all that. However, we need a sincere and proactive approach to combating the menace of drug abuse in Nigeria. The first is strengthening the regulatory institutions. What are these regulatory institutions? The NDLEA, the NDLEA, Pharmacy Council of Nigeria, NAFDAC, Custom, Immigration, and the Federal Ministry of Health. This has to come together and ensure that there is proper regulation in the importation into this country, manufacture, distribution, use, and sale of these drugs and substances with potential for abuse. I believe you can see that if you go around even in this Sokoto metropolis, you see a lot of patent medicine stores that operate. They sell all sorts of drugs, which according to law, it is not everything that they are supposed to sell. In 2010, if I can remember very well, I went to a patent medicine store in Kaduna Drug Market. I saw somebody coming to buy pentazocine in a patent medicine store. The person just sold him. I said, why are you selling pentazocine to without prescription? The person selling doesn't even know that pentazocine is a controlled drug, that it needs to be sold under prescription by a qualified medical personnel. So that is what we have even everywhere. Majority of these small chemists and patent medicines, they don't even know these controlled drugs. That is why they can sell them free to the abusers. But somebody with a registered pharmacy premises know that he has something at stake. If he went and give this drug to inappropriate person, once he is caught, it is not about losing what he sold or his license that he worked for years is at stake.
The battle against drug abuse is far from over. But as we have seen today, hope is not lost. With unified action by government, health professionals, and the communities themselves, Nigeria can reclaim its youth and secure its future.